Nebraska Cancer Specialists, they pride themselves on their dedication to respect, integrity, compassion, hope, and excellence.
With that mission comes patient care that's comprehensive and personalized.
Yeah, here to shed some light on the one specific form of treatment, Dr. Ralph Hauke. Thanks for coming in, Doctor. Good to see you again.
Thank you.
One of the things we're talking about today is immunotherapy. What is immunotherapy?
So immunotherapy is where what we're trying to do is get the person's immune system to fight the cancer better. As it turns out, having cancer for many different reasons suppresses the immune response against the cancer. And so there's a whole new class of therapies that have been developed to try and overcome that resistance.
So tell us, what are the different types of immunotherapy?
So there's several. The ones that are the biggest right now is that there are interactions that occur between the cancer cell and the immune cells that turn the immune cells off, and there's antibodies that block that interaction, so it allows the immune cell to continue doing its work. We also have an emerging class of vaccines that you can inject directly into tumors, and it's a virus that infects the tumor cell, kills it, releases proteins that help the immune system react better against it. Then there's other ones that are now coming down the pipeline in research that are working specifically directly on the immune cells to try and augment them to work better. So a number of different subtypes of immunotherapies.
But it seems like with any type of treatment you have, or whether immunotherapy, it seems like there's always side effects. I don't know, is that the same case with these?
It is. It's a different. There's different differences between them, between traditional chemotherapy and immunotherapy. Immunotherapy, first of all, things tend to be a little bit more delayed, so both responses but as well as side effects. Yeah. The side effects that we have are really not the classic, like you have chemotherapy, nausea, vomiting, things like that. Yeah. Immunotherapy, you can actually have the immune system that can attack normal tissues. So you can have what are called autoimmune side effects, similar to when people have rheumatoid arthritis, lupus, Crohn's disease, those kinds of things. Yeah. So those are things that we have to monitor for. The incidence of that occurring, though, is a lot less than, for instance, in chemotherapy for nausea and vomiting. And for most patients, as long as you catch it early enough, don't let it advance, we can control it with things like steroids and things like that. So
I'll go for it.
I'm sorry. Immunotherapy, how long, getting your immune system to help fight cancer better, how long has that research been ongoing? Is it fairly new?
Well, it's been something of interest for decades, but it really wasn't until around 2000, 2001 that in the basic science side, they identified some of the proteins that interact between the cancer cells, and that's what allowed the development of antibodies. So really, I would say that the big break in immunotherapy has been within the last 15 years. And as far as that new class of drugs actually coming into being as far as clinical trials, it's really only been the last 8 years or so.
Yeah. So not too long.
Now, I'm new to this subject. I tried to do my research online, but talk about the treatment. How many times does someone need to have the immunotherapy?
So the treatment, varies the frequency depending on the drug, but essentially you have to really give it several months before you can really determine whether it's working or not. And that's still something a little tricky, that sometimes the cancer seems to be progressing, but if everything's going okay, you hold on for a little bit longer, and then you'll have responses later on. So you have to use a lot of clinical judgment in determining whether. But right now, one of the downsides, I would say, it's a good thing, but it's economically and for the patient kind of, if they're having a good response, that currently the standard of care is ongoing continuous treatment.
Right. So
to think that you're going to have somebody on these expensive drugs for years and years is somewhat of a next phase of important research and discussion.
Yeah, but the overall benefits of immunotherapy, I mean, we've touched on them, but can we kind of sum that up a little bit? What are the overall benefits?
So the benefits are, compared to traditional chemotherapy, less toxicity.
Yeah.
And I think the biggest potential benefit to immunotherapy is that, in contrast to chemotherapy, where in most cancers it's going to work for only a limited amount of time, immunotherapy in a subset of patients, and it's really looking somewhere between 20–25% of patients across tumor types, may be long-term responders. So these are folks that can have, essentially you're turning cancer into a chronic disease, which is really the kind of the home run, if you will.
Is it used in conjunction with chemotherapy as well, or are they totally separate, and do you treat? Yeah,
they're usually separate. We're starting to get into that part of combining different therapies, and that really depends on the tumor type.
Yeah.
There's clearly For instance, if you add radiation to immunotherapy, you can sometimes see some added benefit to that. So those combinations are all things that are being explored.
Well, if you would like more information, head on over to nebraskacancer.com to check out the Nebraska Cancer Specialists and learn more about immunotherapy on the website, of course, as well.
Yeah,
too,
and it's
right?
still advancing. I know there's a long ways to go in cancer research, and the different therapies, chemo, and using your body's own immune system. I mean, there's still a lot of unknowns, but it's encouraging, isn't it?
It is, absolutely.
Yeah.
Yes.
Doctor, thanks for your
Thank you
time
for
today.
your
We
time.
appreciate it.
Thank you very much.
Guests of the Morning Blend start their day with coffee from Pears Gourmet.